Hi, my name is Dr. Hubert Pham. I'm an ophthalmologist practicing in Fairfax, Virginia, and also the founder of Tacit Solutions, of which one of the products is Tacit Scribes. I created this demo just to kind of give you a brief overview of how we work from day to day and how it helps to improve my practice tremendously. I'm happy to give you a live demo, and I look forward to hearing from you soon. Thank you so much. Hi, everyone. My name is Dr. Hubert Pham. I'm a practicing ophthalmologist, and I just wanted to give you a little preview of how Tacit Scribes works. So, as you see here, I'm in my clinic. Okay, I'm actually in my clinic, and I'm showing you what it would be like with a fake patient. I saw 32 patients this morning, and it got done by 12:15, and all my notes were done. And I want to show you how that's possible. So, what I would normally do is I'd come over to my room. So, this is room 7, for example, and I say to my scribe, I have a lapel mic on. And I say to my scribe, "Hi, Benji, I'm going to go into room 7." And so I knock and I say, "Hi, hello there. How are you?" Okay, there's no patient in here, but you get the idea, right? And so I pull up their chart like I normally would, right? I'm going here, I'm pulling up their chart, and now I'm going to make it so that you can see the computer and what I'm doing and where my hands are or aren't. What I usually would say is, "Hi, Mrs. Doe, let me go and take a look at your, how are you doing?" And so we kind of chit chat a little bit, and I said, "Looks like you're here following up, and it sounds like you're having a little bit of trouble with that left eye." So I go on and I pull up her chart. And this is me just normally pulling up her chart. And I say, "Okay, well, let's see. Says you have blurry vision in the left eye, as you can see from here." I'm just reviewing what the tech would say to me, right? So I'm reviewing a couple of things and I say, "Okay, you're not taking any drops. I'm reviewing your medical history. Seems reasonable. You had cataracts in your grandmother. Great. Looking at your vision, it does look a little worse in your left eye. Your pressure is great. I know that we want to make sure your pressure is under control here. And I'm just taking a look at the prior notes. It all looks reasonable. I in hand have your printed visual field. Of course, this could be here in the imaging section, but in this particular case. So let's say, let me take a look at your visual field to make sure that glaucoma is not getting worse. Right eye, let's say you have a superior arcuate. Now notice my hands are not on the computer. I'm not doing any of this. Benji's doing all of it for me. So right eye, you have a superior arcuate with good reliability, a mean deviation of negative 1.4, and that has not changed from last time, so it's unchanged. Left eye, everything is looking good. You have a full field, let's say, and mean deviation is 0.13, and it looks unchanged. So great. Your visual field looks great, Mrs. Doe. Thanks so much for doing that. And then I would then take an opportunity to take a look at the photos. So what I would do next is I would scroll down to the photos, and obviously I would load the photos, and you can't right here because it's a dummy patient, but you get the idea. I would say, "Okay, well, looking at your photos here, it looks like you had some cupping and again, I'm not touching the screen, but I pretend I'm looking at the photos. You have some cupping and some drusen in the left eye. That has not changed. And this is the second time we've taken that. So we're monitoring you, but things look really good. So things are stable so far. Let me go ahead and take a look at your eyes and see what that looks like, right?" So at this point, after I scroll and look at the things that I had done before and kind of gone over the testing, I never touch a computer again. So just looking at the things and POAG and all that kind of stuff, let's say I've reviewed it at this point, like previous, I would go over to the slit lamp and I would start to look at the patient. Obviously, there's not a patient here, but let's pretend that the patient here, I'm looking inside and I'm going, okay, it looks like you have a 2 plus PE in both eyes. Okay. Great. And can you look to the left and right and all these kinds of things? That's how I would normally, it would normally go. And I would say, your right eye has a 1 plus NS. Great. And 2 plus cortical. Oh, and now looking at your left eye, see where you're having the problem. It looks like you have it a 2 to 3 NS and 3 plus cortical, and you dilate to 7 millimeters. So that's interesting. Okay, that seems to have gotten worse since the last time I saw you. So let's go ahead and take a look in the back. And so then I just do the normal thing. Of course, the lights are out and all that kind of thing. Let's say I'm just calling out findings here, but you have a zero.6 cup to disc ratio on the right eye. Again, totally making this up. This is all live. And zero point 0.7 in the left eye. But let's say your left eye has some drusen, no pigmentary changes. That's fine. Okay. And I look all around and that looks great. So now I want to go back to the computer area, and this is just talking time. This is the beauty of having a virtual scribe with Tacit Scribes. So I look at the computer and I say, "Okay, So it looks like we want your pressure to be less than 16, less than 19, excuse me, in this particular case, this example case. You're doing great. So in Latin approach, we're going to continue on. However, of course, the big thing is we see that your cataract is a problem in the left eye. And so this is a good opportunity to have face-to-face time while everything is getting done over here. And I'd say, okay, so Mrs. Smith, that cataract in the left eye, let's talk about it. So, when we talk about cataract surgery, we talk about risks and benefits, and we go over the risks and benefits, and we talk about what's important to you. So then I ask questions as to what's important to her and what she would like in a lens, right? And then let's say we finally decide that we want to do a trifocal lens, femto trifocal lens in the left eye only at this point with a goniotomy. And so that's going to be the plan. And so we kind of go over the details. This is what it's like. You can expect this, things to watch out for with in terms of the glare and the halos, etc. And I answer all the questions. What questions do you have for me? It's, and going on. And just to go make sure that we understand everything else, actually. So in this particular case, she has drusen, so I might not have done a trifocal lens, but forgive me, I'm just making it up as I go. But let's say that, in fact, actually, on the fly, let's say that the drusen actually, Benji, was in the right eye. I'm sorry, it was in the right eye the whole time, just to make it good, right? So it was in the right eye. And so the drusen's the right eye, and the exam findings will definitely correspond to that, of course. But the left eye, I don't see a reason why we couldn't do the trifocal lens. We can talk more about it, etc. Does that sound good to you? Would you like to proceed? Okay. So, of course, it just depends. And Benji's listening and knows exactly what's going on here. And let's say we are going to go do surgery. Okay. So the plan has been set to do surgery. At this point, I say, okay, well, Mrs. Doe, if you don't have any other questions, let's walk you to our surgical schedulers and we'll go and do cataract surgery with goniotomy next available in the left eye. Get this out of her way. And I'll walk her up here. We'll grab the thing. And then I leave the room. Now, at this point, I have not touched the computer since after looking. I grab her chart and I grab the patient, of course, which we don't have. And then I leave the room. And I then go on to the next. And I show her the way to the scheduler, or bring her to the scheduler. And then at this point, I say, okay, Benji, I'm going to go to room 5. And so I go to room 5 and I repeat the same thing. And at this point, the note is already done by the time I get into room 5, and we're ready to repeat the whole process. And so that's just a brief impromptu overview of what it's like to work with Tacit Scribes. Of course, you do that 50, 60 times a day, and it really kind of comes to a smooth flow. So thank you so much for considering Tacit Scribes, and I hope to be able to meet you sometime and answer any questions you have. Thank you.